Most people think diabetes shows up in blood tests first, but what if I told you your feet might be trying to warn you long before that, quietly sending signals that are easy to miss until it's too late? Today, we're going to talk about something that often goes unnoticed, especially among older adults, and that is the hidden warning signs of diabetes that can appear right on your feet. This is not just about discomfort or aging, it's about recognizing early signals your body is giving you before more serious complications develop. If you or someone you love is over 50, this information could make a real difference in maintaining health and independence. Before we begin, take a moment to listen closely, and if any of these signs feel familiar, don't ignore them. I'd also love to hear from you. Have you or someone in your family ever experienced unusual changes in your feet that turned out to be something more serious? And where are you watching from today? Sharing your experience might help someone else feel less alone. This topic matters deeply because diabetes often develops slowly, and by the time it is diagnosed, damage may already be happening, especially in the nerves and blood vessels of the feet. The good news is that the body often gives early clues, and learning to recognize them can help you act sooner rather than later. 1. One of the earliest signs many people overlook is persistent numbness or tingling in the feet, and it often begins so subtly that it is easy to ignore or explain away. You might notice a light pins and needles sensation when you sit for too long, or a slight buzzing feeling in your toes when you lie down at night, and at first it may come and go without much concern. Over time, however, this sensation can become more frequent, lasting longer or spreading across the foot, and this is where it becomes important to pay attention. This feeling is not just about circulation or posture, as many assume, but can be an early sign of nerve damage caused by consistently elevated blood sugar levels. When glucose remains high in the bloodstream, it can slowly damage the tiny nerves responsible for sensation, especially in the extremities like the feet. What makes this particularly concerning is that as the nerves become more affected, the tingling can gradually turn into reduced sensitivity, meaning you may not feel injuries, cuts, or temperature changes the way you normally would. For older adults, this creates a silent risk, because something as small as stepping on a sharp object or wearing tight shoes could lead to an injury that goes completely unnoticed. Recognizing this early sensation, even if it seems mild, can be a critical step in identifying a deeper issue before it progresses further. 2. Another warning sign that often causes concern, especially when it begins to interfere with rest, is a burning or sharp pain in the feet, and this sensation can feel very different from ordinary aches or fatigue. Many people describe it as a deep, uncomfortable heat or a stabbing feeling that seems to come from inside the feet rather than the surface, and it tends to become more noticeable in the evening or during the night when the body is at rest. At first, it may only happen occasionally, perhaps after a long day of walking or standing, but over time it can grow more persistent, making it difficult to fall asleep or stay asleep comfortably. This kind of pain is often linked to diabetic neuropathy, a condition where prolonged high blood sugar begins to damage the nerves, causing them to send abnormal signals to the brain. Instead of transmitting normal sensations, the nerves may create feelings of burning, shooting pain, or extreme sensitivity, even when there is no clear physical cause. What makes this particularly challenging is that the pain can feel worse when there is less distraction, such as at night, leading many people to believe it is simply part of aging or fatigue. However, this type of discomfort should not be dismissed, especially if it becomes a pattern. Over time, untreated nerve pain can progress and affect mobility, balance, and overall quality of life. For older adults, this can increase the risk of falls or make daily activities more difficult, which is why recognizing and addressing this symptom early is so important. 3. Another sign that often seems harmless at first, but can carry deeper meaning, is unusually dry or cracked skin on the feet, especially around the heels and soles. Many people naturally experience drier skin as they age, so it is easy to assume this is just a normal part of getting older, or perhaps the result of weather changes or not using enough moisturizer. However, when the dryness becomes persistent, severe, or starts leading to visible cracks in the skin, it may be pointing to something more than just surface-level irritation. In people with developing or unmanaged diabetes, nerve damage can affect the small nerves that control moisture and oil production in the skin. When these nerves are not functioning properly, the skin loses its ability to stay naturally hydrated, becoming rough, flaky, and more fragile over time. As the skin becomes more brittle, Even small cracks can deepen and create openings that allow bacteria or fungi to enter, increasing the risk of infection. What makes this particularly concerning is that, when combined with reduced sensation in the feet, a person may not even feel these cracks forming or worsening. Something that begins as mild dryness can quietly progress into painful fissures or infected areas without drawing much attention. For older adults, this risk is even higher because the skin is already thinner and slower to heal. Taking note of changes in skin texture, especially when dryness does not improve with basic care, can be an important early signal that the body is struggling to regulate itself properly. Paying attention to these small changes and seeking advice when needed can help prevent more serious complications from developing later on. 4. Slow healing cuts or wounds on the feet are one of the clearest warning signs that something deeper may be affecting the body, and yet they are often overlooked in the early stages. It might begin with something very small, like a blister from a pair of shoes, a minor scrape, or even a tiny crack in the skin that doesn't seem serious at first. Under normal conditions, the body begins repairing these minor injuries almost immediately, and within a few days you would expect to see noticeable improvement. However, when diabetes is present or developing, this natural healing process can become much slower and less effective. Elevated blood sugar levels can interfere with circulation, reducing the flow of oxygen and essential nutrients to the affected area, which are both necessary for tissue repair. At the same time, the immune system may not respond as efficiently, making it harder for the body to fight off bacteria that can enter through even the smallest opening in the skin. As a result, what should be a simple and temporary issue can linger for weeks, sometimes worsening instead of improving. The edges of the wound may remain open, the surrounding skin may become discolored, and there may even be signs of infection such as redness, warmth, or discharge. For older adults, this becomes particularly dangerous because slower healing combined with reduced sensation means the injury might not receive proper care right away. A person may not feel pain or urgency, allowing the wound to progress unnoticed. Over time, untreated wounds can develop into ulcers, which are much more serious and require medical attention. Recognizing when a cut or sore is not healing is expected as a critical step, because early intervention can prevent complications that are far more difficult to manage later on. 5. Changes in skin color on the feet can be another quiet but meaningful signal that the body may be struggling with blood sugar control, and these changes often develop gradually, making them easy to overlook if you are not paying close attention. You might notice areas of the skin becoming slightly darker than usual, or perhaps patches that appear reddish, pale, or even faintly bluish, especially around the toes or the soles. At first glance, these shifts in color may not seem alarming, and many people assume they are simply due to pressure from shoes, minor bruising, or normal variations in skin tone. However, when diabetes begins to affect circulation, the blood flow to the extremities can become less efficient, and this can directly influence how the skin looks. Reduced circulation means that oxygen is not being delivered as effectively to the tissues, which can cause the skin to appear dull, pale, or even slightly grayish in some areas. On the other hand, persistent redness can sometimes indicate inflammation or pressure points that are not healing properly. In more advanced cases, darker patches may develop due to prolonged stress on the skin or underlying tissue changes. What makes this particularly important is that these color changes can be early indicators of circulation problems that may worsen over time if left unaddressed. For older adults, whose blood vessels may already be less flexible, this can increase the risk of more serious complications. When combined with other symptoms like numbness or slow healing, changes in skin color should not be ignored. Taking the time to regularly observe the feet, including the tops, soles, and between the toes, can help you notice these differences early. If a color change does not fade or seems to spread, it is a good reason to seek medical advice, as early attention can help prevent more serious issues from developing. 6. Swelling in the feet or ankles is another sign that can seem familiar and harmless at first, especially for older adults who may already experience some level of fluid retention after a long day. It might show up as tightness in your shoes, a feeling of heaviness in the feet, or visible puffiness around the ankles that leaves an imprint when you press gently on the skin. Many people assume this is simply due to standing or sitting for too long, or even just part of the natural aging process. However, when swelling becomes persistent, appears without a clear reason, or worsens over time, it can be an important signal that the body is not regulating fluids and circulation as well as it should. In the context of diabetes, swelling can be linked to poor blood circulation, where blood has a harder time flowing efficiently through the vessels, especially in the lower extremities. When circulation slows down, fluid can begin to accumulate in the surrounding tissues, leading to noticeable swelling. In some cases, this may also be connected to the way diabetes affects the kidneys, which play a key role in balancing fluids in the body. When the kidneys are under strain, excess fluid may not be removed as effectively, contributing to swelling in the feet and ankles. What makes this more concerning is that swelling can mask other problems, such as small wounds or pressure areas that are harder to see when the skin is stretched and puffy. For older adults, this can increase the risk of unnoticed injuries, discomfort when walking, and even reduced mobility over time. If swelling does not improve with rest, elevation, or simple lifestyle adjustments, or if it appears alongside other symptoms like numbness or skin changes, it is important to take it seriously. Paying attention to these subtle shifts in how your feet look and feel can help you recognize when something deeper may be affecting your health. 7. Frequent infections in the feet, especially those that seem to return again and again or take longer than usual to clear up, can be an important warning sign that something deeper is affecting the body's ability to protect itself. Many people experience occasional issues like athlete's foot, minor fungal infections between the toes, or irritation around the toenails, and these are often treated at home without much concern. However, when these infections become persistent, spread more easily, or do not respond well to basic treatment, it may be a sign that the body's natural defenses are not working as effectively as they should. In people with diabetes, elevated blood sugar levels can create an environment where bacteria and fungi thrive more easily. At the same time, the immune system may not respond as quickly or as strongly, making it harder to fight off infections once they begin. This combination means that even a small area of irritation, such as a damp space between the toes or a tiny cut near the nail, can develop into a more stubborn problem. You might notice redness, itching, peeling skin, or a persistent odor that does not go away with regular hygiene. In some cases, the skin may become soft and white between the toes, or the nails may become discolored and fragile due to fungal growth. What makes this particularly concerning for older adults is that these infections can quietly spread or worsen without causing significant pain, especially if there is already some level of reduced sensation in the feet. Without early attention, a simple fungal infection can lead to cracks in the skin, which then become entry points for more serious bacterial infections. Over time, this can increase the risk of complications that are much harder to treat. Recognizing when an infection is not improving, or keeps coming back, is an important step in understanding that it may not just be a surface issue, but a sign that the body needs additional care and medical attention. 8. Thickened, yellowing toenails are often dismissed as a simple cosmetic concern or a natural part of aging, but in many cases, they can be a meaningful signal that something deeper is affecting foot health. You might first notice that your toenails are becoming harder to trim, losing their usual smooth appearance, or changing color from clear or pale pink to a dull yellow or even slightly brown. At times, the nails may also become brittle, crumbly at the edges, or begin to separate slightly from the nail bed. While these changes can happen gradually, they should not be ignored, especially when they continue to worsen over time. In individuals with diabetes, these nail changes are often linked to fungal infections that develop more easily due to elevated blood sugar levels. Fungi thrive in warm, moist environments, and when the body's immune response is not as strong, these organisms can grow more freely and persist longer than usual. Poor circulation can also play a role, as reduced blood flow makes it harder for the body to deliver the nutrients and immune support needed to keep the nails and surrounding tissue healthy. As a result, what begins as a mild discoloration can slowly turn into a thicker, more distorted nail that is difficult to manage at home. For older adults, this can create additional challenges. Thickened nails can press against the inside of shoes, leading to discomfort, pressure points, or even small injuries to the surrounding skin. If not carefully managed, these areas of pressure can develop into sores or infections, especially when combined with reduced sensation in the feet. Taking note of these nail changes and seeking proper care, whether through a healthcare provider or a trained foot specialist, can help prevent further complications. What may seem like a small change in appearance can actually be an early sign that the feet need closer attention and care. 9. A loss of sensation in the feet is one of the most serious warning signs, yet it can also be one of the most difficult to notice in its early stages because it often develops gradually rather than all at once. At first, it may feel like a slight dulling of sensitivity, where textures under your feet do not feel as clear as they once did, or where the difference between warm and cool surfaces becomes less noticeable. Over time, this reduced awareness can progress to the point where certain sensations, including pain, pressure, or temperature, are only faintly felt or not felt at all. Many people only become aware of this change when something unexpected happens, such as stepping on a small object or developing a blister without any memory of discomfort. This loss of sensation is commonly caused by diabetic neuropathy, where prolonged high blood sugar damages the nerves responsible for carrying signals between the feet and the brain. As these nerves become impaired, the body's natural ability to warn you about injury or irritation begins to fade. This creates a silent risk, because pain, which normally acts as a protective signal, is no longer reliable. For older adults, this can be especially dangerous, as balance and coordination may also be affected when the feet cannot properly sense the ground. This increases the likelihood of falls, as well as unnoticed injuries that can worsen over time. What makes this condition particularly concerning is how easily small problems can go undetected. A pebble in a shoe, a wrinkle in a sock, or even a minor burn from hot water can cause damage without being felt. Without regular visual checks, these issues can develop into wounds or infections before they are discovered. Recognizing a gradual loss of sensation and taking it seriously is essential, because early medical attention and careful daily foot care can help reduce the risk of more severe complications and protect long-term mobility and independence. Let's take a moment to imagine a real situation that many families face. An older man begins to notice that his feet feel slightly numb in the evenings. He assumes it's just part of aging or perhaps the result of sitting too long. Over time, the numbness becomes more frequent, and one day he discovers a small wound on his foot that he doesn't remember getting. Because he didn't feel it happen, he also didn't treat it right away. Weeks pass, and the wound doesn't heal properly. It becomes infected, and eventually, he needs medical attention that could have been avoided if the early signs had been recognized. This kind of situation is more common than people realize, and it often starts with small, subtle changes that seem harmless at first. From a scientific perspective, elevated blood sugar levels can damage both nerves and blood vessels. The nerves lose their ability to send clear signals, which is why sensations like pain or temperature may fade. At the same time, reduced blood flow means the body cannot deliver enough oxygen and nutrients to heal even minor injuries. When these two problems occur together, the feet become especially vulnerable. What makes this more challenging is that many of these symptoms develop gradually. There is no sudden alarm, no sharp turning point that demands attention. Instead, it is a slow progression, which is why awareness and regular self-checks are so important, especially for older adults who may already have reduced circulation or mobility. Here is the part that often surprises people the most. In many cases, serious complications like foot ulcers or even amputations don't begin with major injuries. They begin with something as small as a tiny crack in dry skin or a blister from a shoe that didn't fit quite right. When combined with reduced sensation and poor healing, that small issue can quietly grow into a life-altering condition. What makes this truly concerning is that many people do not feel pain as a warning. The body's natural alarm system is weakened, so by the time the problem becomes visible, it may already be advanced. This is why paying attention to these early signs is not just helpful, it can be life-changing. The important thing to remember is that your feet can tell you a great deal about your overall health. Numbness, pain, dryness, slow healing, and changes in appearance are not just minor inconveniences, they are messages that deserve attention. Recognizing these signs early gives you the opportunity to seek medical advice, make lifestyle changes, and protect your health before complications develop. There is hope in awareness. By simply taking a few minutes each day to check your feet, staying mindful of changes, and not dismissing unusual symptoms, you can take an important step toward preventing more serious problems. Small actions can lead to meaningful protection for your future. If you found this information helpful, please take a moment to like this video and subscribe to the channel so more people can learn about these important warning signs. Share this with someone you care about, especially a parent or grandparent who might benefit from hearing it. And before you go, remember this. Your body often whispers before it shouts. Listening early can make all the difference.